Hi everyone, my name is Tammy Gomez and today I'm going to share my evidence-based practiced project proposal with you. The focus of my project is nurse burnout, something I think a lot of us have either experienced or even witnessed during clinicals or at work. For this proposal, I developed a plan to implement a mindfulness-based stress reduction program, or MBSR, to help address burnout and support nurse well-being. We all know nursing can be incredibly rewarding, but also extremely stressful. Nurse burnout is a big issue right now, especially after the pandemic. It's when nurses feel emotionally drained, detached from their work, and feel like they're not making a difference. My project proposes using mindfulness, a structured program called MBSR, as a tool to help reduce burnout and promote mental resilience among hospital nurses. The goal basically is to evaluate how effective it is over a 12-week period. The research on burnout is pretty alarming. One study found that over 34% of nurses were emotionally exhausted during the pandemic, while another study showed burnout increasing across 38 different countries. And one even found that burnout could actually affect your biology by shortening your telomeres, which means it actually might speed up your aging, which is actually quite wild. So basically, the point is that this isn't about stress. It's a serious health and patient safety issue. And that's why I think trying something proactive and evidence based like MBSR is worth exploring. So I created four main objectives for this project, and they're all SMART. They're specific, measurable, achievable, relevant, and time-bound. So first, I want to reduce emotional exhaustion by 20%. Then second, I want to increase job satisfaction by 15%. Then third, increase the nurses' intent to stay in their roles by 10%. And lastly, I want to see if MBSR can realistically be worked into the nursing workflows without adding any extra stress. These objectives focus on improving both the nurse experience and the workplace environment. So for this design, I chose a quasi-experimental setup. That means that I'll have two similar med-surg units in a hospital. One will get the MBSR intervention, and the other will keep doing what they normally do. The study should run for 12 weeks, which gives enough time for planning. The 8-week program itself, and collecting and analyzing the data. This approach works well in real-life settings where full randomization might not be possible. So the MBSR program lasts 8 weeks with weekly hour-long sessions. These sessions include meditation, body scans, and mindfulness exercises led by a trained facilitator. Nurses will also get resources to practice daily as well. The rollout will happen in 4 phases: planning, delivery, evaluation, and sharing the results, obviously. I also considered barriers like time constraints, so the sessions would be scheduled flexibly and we'd get support from leadership to make it happen smoothly as well. So to measure success, I will use the MASLAC Burnout Inventory to track emotional exhaustion, and I'll use validated surveys for job satisfaction and retention intent. I'll compare the results before and after the intervention using the t-test and ANCOVA. On top of that, I'll hold focus groups to hear directly from obviously the participants and what worked and what didn't work. And everything will be done ethically, obviously, and of course, with consent and IRB approval to protect everyone that's obviously involved. I'm expecting to see lower burnout scores and higher job satisfaction and stronger retention intent among the nurses who go through the MBSR program. So long term, this could lead to better patient outcomes, fewer staff calling out or even quitting, lower turnaround rates, and overall more positive work culture. It might save hospitals money by reducing turnover, and if it works well, it's something that could be used in other units or even across entire facilities. So, to wrap things up, nurse burnout is a huge challenge, and honestly, we need real solutions. This project takes an evidence-based practice approach to try something that could actually help nurses feel better, stay longer, and even take better care of their patients. Mindfulness isn't just something that's trendy, it's backed by science. I hope this proposal inquires more support for mental health in nursing. And again, thank you so much for listening.